So adult orthodontics, Invisalign. You're a big fan of Invisalign.
Yes, it's a little hard with kids because they may not wear them, they lose them, but with adults it's great. As we get older, our teeth start to shift, especially in the front. They get crowded in the front. You might have seen a lot of actors and actresses that have crowded lower front teeth.
Yeah, the lower seems to get crooked.
That's right, and it makes your teeth chip. Your front teeth start to chip and break off, and people don't even know why, and it's because their teeth are crowding as they get older. And it makes it hard for them to clean. I'm telling them, okay, you have a lot of calculus, you're getting bacteria under your gums, and it's because their teeth are crowded.
What is calculus? Like tartar, or what is it?
It's a layer of bacteria that eats away at your gum and bone, and it makes your teeth fall out. And it can get in your bloodstream and cause heart problems and other problems. So they need their teeth to be straight in order for them to even be able to clean them.
So Invisalign, and it can happen fairly quickly, right?
That's right. Invisalign doesn't hurt. It happens where they can get the clear aligners, and after they wear the trays, they're done. Most of my patients, we also include free bleaching at the end of their program, so they have straight white teeth that are at the end of their process.
And so, what's the oldest patient? How old can you be to get Invisalign? Could you be in your 60s?
You could be in your 60s, you could be a teenager, you could be in your 80s. It will help you to have the smile that you want. It's not an age limit.